Hey, good morning, it's Mark. You may be familiar with the fact that over the last, say, decade or so, hospitals have spent countless hundreds of millions of dollars aligning physicians, talking about the acquisition of physician practices, the direct employment of physicians in states where they can't directly employ, the employment through friendly captive physician groups, captive medical groups, through foundations of independent practices. The idea being to, quote, coordinate care, actually to control care through the hospital. In other words, the creation of hospital-centric healthcare. However, over the more recent past years, there has been an increasing tide of procedures flowing out of the hospital to outpatient facilities, chiefly to ambulatory surgery centers. If you haven't already read my book, The Impending Death of Hospitals, you should pick up a copy. You can get it on Amazon, or you can download a PDF version for free on my website at advisorylawgroup.com. The synopsis is that as technology increases, as the safety of performance of procedures at ASCs increases, more and more procedures are being added to Medicare's list of approved outpatient procedures, surgery center procedures, meaning that there's now Medicare reimbursement for an increasing number of procedures. And additionally, because many, if not all, private payers follow Medicare's lead on this, private payers too are pushing procedures out to ASCs because reimbursement is much lower and outcomes are much greater. Less chance of infection, more efficiency, more happy patients paying lower copays and having much better patient care experiences, as well as just much better customer experiences. So now we're seeing something very interesting. We're seeing, in connection with my ASC work, physicians, my clients, going and forming physician-owned ASCs. And what we're seeing now are hospitals chasing those physician deals. Hospitals which understand that soon they will no longer be able to compete with many procedures that had been done on an inpatient basis, that will be done on an outpatient basis. They can no longer compete on the basis of having those cases performed in HOPDs, hospital outpatient departments, because reimbursement for the same procedure is up to 80% higher in HOPDs than ASCs, but an HOPD is simply an ASC that is owned by a hospital, run under a hospital license. So hospitals want to sort of wiggle their way in, burrow their way into your ASC deal. But why would you want them to align with you? They're simply after the control that they're losing, and they're simply after the profit that they're losing. Many would answer that, well, I want money from the hospital to help seed the ASC. But the bottom line is, if you vet the decision, you vet the numbers in connection with whether it makes sense to form an ASC, and it does, why do you need even $500,000 from a hospital when potentially within a year or two you could be pumping out $2 million a year in facility fee profits from that facility? It's a short-term gain, but the hospital, as a co-owner, is simply presenting long-term pain.